they're smarter than I am. They must have had they must have had a meeting where they all talked. They must have all decided together that Josie needed the methadone for reasons that I probably would never understand. So I stood aside. The nurse gave Josie the methadone and walked away. And the other nurse and I continued putting the fast tracing on Josie's feet. And the nurse looked at Josie and said, "Look, Sorrel, a crocodile tear." And I looked, and she had one tear coming down her cheek, and I wiped it away. And I said, "It's so weird. We've been here, for almost 2 weeks, and she's never once cried. She's never once shed a tear." I wiped the tear away, and then the next time I looked at Josie, she was completely passed out, completely unresponsive, and I'm screaming for help, and the nurse is pushing buttons, and doctors and nurses came running to her bedside with metal trays and metal carts and instruments, and they were all surrounding her bed and pushing buttons and doing things to her. And they put me out into the hallway, and then they put me into a room with a chaplain. The next time I saw Josie, they took me back up the back steps, back up into the FICU. And I walked into her room, and she had tubes coming out of every part of her body. And the doctors and the nurses were standing around her bed. And I walked in there, and I said, "This is okay. You did this to her. Now you need to fix her. I don't care what it costs. I don't care what it takes. I don't care who we have to fly from around the world. I don't care what organ we need to find. We will do whatever it takes to help you fix her because you did this to her. And we're having a welcome home celebration day after tomorrow. You need to fix her because we're going home." And they told me I needed to pray, and they left the room. The next morning, a team of neurologists came into the room, and they examined Josie, and they sat down with Tony and me, my husband, Tony, and they sat down and they said, "She's brain dead. She has no brainstem function. She will not live." And I said, "Well, we're going to wait for a miracle. There'll be a miracle. I was just in the waiting room with another miracle, and her daughter's living with another mother who had a miracle, and her daughter's living. We'll wait for a miracle. There'll be a miracle. We're going to wait. She's going to live. There'll be a miracle." And the neurologist said, "There'll be no miracle. Her organs are already shutting down. She has no brain function. She's beginning to die. It'll be a number of hours. It could be 2 days, but she's dying." So that afternoon, Josie's older siblings, Jack, Relly, and Eva, came down, and we all said goodbye to Josie and took her off of life support, and she died. So in 24 hours, we had gone from planning a welcome home celebration to planning a funeral. As you can imagine, our worlds were shattered, our lives were turned upside down. The thing with Josie's death, like so many deaths from medical errors, was that it wasn't the fault of a doctor. It wasn't the fault of one nurse. It wasn't a misplaced decimal point. It wasn't a wrong medication. It was something so simple that for weeks and for months